Hi, I'm Cindy, and join me as I dive into the reality of whether mature nurses can truly afford to retire. Can I uncover the financial secrets that could change everything? As a nurse, you've dedicated your career to helping everybody else, but have you really taken the time to plan your own financial future? Because I know I didn't. So did you know that as of 2024, only 56% of nurses were on track with their retirement planning? Many nurses that I talk to are really worried about retirement. They've got health issues. They have disabled spouses. They're suddenly single again. If you can relate, then this video is for you. I'm Cindy, and I'm a nurse. I retired last year at 62 because I was burnt the heck out. And yes, I had started planning for retirement, but not until I was up in my 40s. And it's a little hard when you're trying to play catch up, right? I was a single mom, 3 kids. I'm proud to say they've all been through college, but it was a struggle. And so when you start a job and they tell you, your employer tells you, you can put in, up to say 15% in a 401k. I couldn't afford that, when in reality, I couldn't afford not to. But by then it was too late. So just like so many of you who haven't saved enough, or you can't afford to stop working, that's where I was. That's exactly where I was. And even though I had a job that I had loved, I no longer loved it, and I knew I needed out. So the truth is, nursing is so demanding, as we all know. It takes a toll on us physically and mentally. And it takes away from our relationships, It takes away from time with our children, time with our families, time to grow a friend group. So truthfully, nurses, including myself, we are not good about prioritizing ourselves, either financially or mentally. Or medically even, right? Sometimes we don't stop until we're forced to stop. So it can be really hard to think about retiring when you're still in the thick of it. You're still raising a family. Maybe you've got adult kids that move back home. Maybe you're raising grandkids now, right? Just when you thought it was finally going to be your time, suddenly it's not about you again, right? But the reality is that those of us that are over 50 are facing a retirement crisis. So if this hits a nerve, I would suggest that you go to the link in the description and put in your email and grab my free blueprint. In there, there's a couple of short videos that can explain what I'm talking about a lot better than I ever could. This opportunity that I'm sharing with you can change everything. It can change everything. It changed it for me. It allowed me to retire 1 year early because I have passive income working for me, coming in the background. So many nurses do face financial difficulties as they approach retirement. They are real, my friend, real. A lack of savings, inadequate planning, and uncertainty about the future are just a few of the many challenges. Pensions are a thing of the past, right? Unless you work in public service. And then the salaries when you are working are generally less than they are in the private sector. So again, when you're in the thick of it, it is hard to balance out. Can I afford to put the max in, or do I need this just to pay a bill? The struggle is real, definitely, right? So maybe you didn't contribute to your 401k thinking that you couldn't afford it, when in reality you couldn't afford not to. Maybe you were a single parent, like I was, with little to no support from the other parent, and you struggle just to survive, let alone save anything for retirement. For some, the idea of retirement seems like a luxury that you can't afford. And at the point when you're raising your family, it seems like it's a million miles away. But guess what? It's here before you know it. Before you know it, you are 60 plus and staring down the end of your career. And maybe you're ready, maybe you're not. But a lot of nurses that I know and talk to don't retire even if they are prepared, because they're worried about running out of money. Let's face it, one good medical event for you or your spouse could wipe out your savings. And even when you do have to retire, because it's a necessity medically, as in my case, you have to figure a way out. Does this sound like you? Does this start to ring some bells? Is it resonating with you? Then I really encourage you to look over my blueprint. Just go to the link in the description and you'll see it in there. Maybe it's not for you, but what if it is? So just because you decide that you need to retire and you know you're going to bring in less income, that doesn't stop the rising cost of everything else. Healthcare, living expenses, unexpected things that you didn't prepare for, having to buy a new car, increase in food, increase in transportation. Maybe you can't drive anymore and you have to pay people to take you places. Then what, right? And we don't even want to talk about all these unexpected things like, a roof on your house, just trying to maintain your home and not let it get into a state of disrepair. Being able to stay in your own home. These are all things that you can't just go and pick up an extra shift for because you're burned the heck out. Or maybe you physically can't do it anymore. All of those long hours that you work taking care of everybody else, it takes a toll on your ability to save for retirement. You've spent so many years putting everybody else first, including your family, at the expense of your own well-being, financially, physically, mentally. So the result is that we have a retirement savings gap, and it can be very alarming. But I'm here to tell you the good news. The good news is that there is hope. You do have options. And when you start looking around and seeing what's out there, look to see the factors that are contributing to this crisis and then looking at the solution, nurses and women in particular can take control of their financial future. It is not too late, my friend. I'm telling you, it is not too late. With some planning, some resources and support, you can create a more secure financial retirement. There are some key insights that can help nurses prepare for a more secure retirement. Financial planning resources, community support, and education all play a role, and they are very important. So for example, if your employer sponsors a 401k plan, that plan administrator generally has a financial planner that you can have access to go over your goals and plan accordingly. How much do you have to put in to get caught up? So check with your financial institution. Mine has a financial planner on staff that I can access for free. But the key is to get the information. Knowledge is power. What are your goals in retirement? To be debt-free, to travel, college fund for the grandkids, raising grandkids. These things are important and if accounted for, very manageable. So you want to take advantage of these resources, my friends, and you can start building a more stable financial future. This might involve reevaluating your spending. Is it a want versus a need? Create a budget and make a plan for retirement savings. It could also mean exploring alternative income streams or retirement options. Do you want to fully retire or retire from nursing and do something else? In my situation, I retired from public health nursing and I continued to do some contract work for an insurance company and I built my digital business. Truthfully, I don't want to work full time. There was a reason I retired. I was burned out. So I don't want to walk back into something else and punch a time clock. But I don't have to because this online business gives me the flexibility to work when and where I want to, and you can have it too. And I want that for you. The bottom line is retirement planning is crucial for nurses, especially as we approach 50. It's not a one-size-fits-all solution, but with the right support and resources, nurses can take control of their financial future. So if you're a nurse, you're a woman approaching 50, I want to hear from you. Share your experiences in the comments below. And have you started planning for retirement? What challenges have you faced? Let's keep the conversation going. And check out my other videos on how to get ready for retirement for more insights and advice. And don't forget to grab that free blueprint at the link in the description.